right, let's talk about hemorrhagic strokes now. A hemorrhagic stroke occurs when a blood vessel that supplies the brain ruptures and bleeds. When an artery bleeds into the brain does not receive the nutrients and the oxygen that it needs. So those brain cells or those neurons begin to die. Also, the brain is surrounded by the skull. So as you can imagine, there really is no wiggle room. As more bleeding occurs, more pressure gets put onto the brain, causing further damage. Hemorrhagic strokes make up about 13% of stroke cases. A hemorrhagic stroke is classified by the location of the bleed. An intracerebral hemorrhage, meaning it occurs within the brain, or a subarachnoid hemorrhage, meaning that it occurs between the inner and the outer layers of the tissue surrounding the brain. This infographic was found through the Mayo Clinic. Some of the common causes of a hemorrhagic stroke include hypertension or high blood pressure, which can cause small arteries deep in the brain to rupture, a cerebral aneurysm, which is a weak area in a blood vessel that tends to enlarge. Think of this as a little pouch, a little balloon, a bubble, or a bulge. As the aneurysm grows, the walls become thinner and weaker, eventually causing it to burst. Aneurysms can be congenital, meaning that they're present at birth, or they can develop later in life due to factors such as high blood pressure or atherosclerosis. Another common cause of a ruptured blood vessel leading to a hemorrhagic stroke can be arteriovenous malformation or AVM. This is when an abnormal bundle of veins and arteries form in the brain, creating a higher risk of hemorrhage. AVMs are rare, affecting only about 1% of people. The cause of AVM is unknown, but sometimes it is genetic or part of certain syndromes. Other possible causes can include head trauma, being on blood thinners, and heavy smoking, alcohol, and drug use. While a hemorrhagic stroke is less common than an ischemic stroke, they are more likely to be fatal, and those who survive are more likely to experience a long-term disability. So receiving immediate medical attention is important in any kind of stroke. Follow along for more information as May is Stroke Awareness Month.